A very good afternoon and welcome to another episode of Health Matters with Corporate 24. Myself, your host, Shazan. With me, I've got Tario, my co-host, and our guest speaker, Dr. T. Nyapokoto.
Welcome, Doc, to Health Matters with Corporate 24.
Thank you very much.
All right, so we're going to be talking about emergencies. I know a number of people don't really get the term emergencies. Do we have a Shona name or term for emergencies?
Emergencies. Tawana.
So, maybe, yeah.
Okay, so we could say Tawana.
Yeah.
All right, so that's basically what we're going to be talking about today. We're running through a series of things when it comes to emergencies, what exactly an emergency is, and then Doc is going to assist us in understanding better on how we manage stuff.
Yeah.
Okay, Doc.
Yes.
Maybe if you could give us a brief introduction, tell us a little bit about yourself.
Oh, okay. My name is Dr. Nyapokoto. I studied at the University of Zimbabwe. I'm here working as an ER doctor, which is emergency room doctor. So I see a lot of emergencies. So this topic is very, very close to heart to me. So I'm very excited to be here and to talk about emergencies with you.
Great, Doc. Great to have you here. So we can dive right in?
Yes.
Sure. So we'll start. I will alternatively use the word Tawana.
Okay.
So, Chiremba, can you tell us Kwandiri nini tariro? I'm not clinical. Chichinonzi Tawana.
Okay.
What is an emergency?
Okay.
Yeah.
So in layman's language, an emergency is a situation which poses an immediate risk to the life of a patient and it needs immediate attention. So in situation equity, when it happens, you need to act in the short period of time. You understand? Yeah, you need to act on it instantly.
Okay,
yeah.
So is there a difference between an adult emergency or a pediatric emergency? For those of you who don't get the pediatric part, we're talking about our kids, our babies, the little ones.
That's pediatric.
Being clinical.
Soon she'll be a doctor.
Oh.
Anyways, so not really there isn't much difference because kids are also people. So people are basically the same. It's how you handle them that's really different. But the emergencies, and older people is just the same. But how you handle children and older people, it's different.
Okay.
Yeah.
Okay. So in that regard, can you give us examples of emergencies? I know you've explained what an emergency is, but can you give us an example? And I can start.
Yes.
An RTA, road traffic accident.
Yes.
That's an emergency.
Yes. Amazing.
E for effort.
Yeah.
Right,
yes, that's an emergency. Also, for example, an asthmatic attack, especially in children, because asthma is a disease that really gets children more than adults because most people, they grow out of it. So an acute asthmatic attack, it's an medical emergency. We also have bleeding, which can happen after an accident. So bleeding is another one. We can also have poisoning. Exactly, yeah. Most people nowadays, mental health issues, people are committing suicide and taking poisons. So those are just a few of emergencies that we encounter in the ER and just generally.
So Doc, with the asthmatic attack, like you're saying, okay, as a mom, you would worry, in general, you would worry about your kids. And how do I know that, for instance, my child would be having an asthmatic attack? Are there signs that I should look out for and know that, oh my gosh, this is an actual emergency?
That's a very amazing question because there are always warning signs to an emergency. So it starts with breathing. If a child is not breathing the normal way or an adult is not breathing the normal way, then no, something is wrong. If they're gasping and they're breathing fast, when you say this is an emergency. But the most important thing is whoever you are or the child, if you're the mother, don't panic in any emergency. So the breathing is going to tell you, or if there's bleeding, like I said, everyone is scared of blood. Most people are, except us as doctors, we're not really scared of it. But most people are scared of blood. If there's bleeding, then okay, excessive bleeding. Yeah, then no, this is an emergency. So the signs, the breathing, the bleeding, what else could it be? Mental status. For example, confusion, an acute state of confusion in a patient can actually mean maybe there's something going on. Maybe it's low blood, maybe a patient has had poison that has gotten to their brain. Yeah, just their mental status can tell you that this is an emergency. We need to attend to it now.
Okay, so Doc, let's just say I'm not close to a hospital, I'm not close to a clinic. you know, maybe someone that I'm with is feeling dizzy.
Yeah.
How do I know that it's something I can deal with there and have time to get them to the hospital?
Okay, so you never really know in particular that you can deal with it, because yeah, if you're not trained for it, you never really know. So the best thing that you can do, even I as a doctor, when there's an emergency, call for help. Like if there are people around, call for help. Even I, when I'm faced with an emergency, I cannot tackle it on my own. I have to call my team, the nurses, everyone has to be on board. So wherever you are, call for help. If you've got people at home, the father, your helper at home, siblings, call for help. And then afterwards, when you have, you know, when you're now many, you call an ambulance or other services that can make you or help you go to the hospital as soon as you can, because you can't just start tackling issues that you can't really deal with.
All right. So we've heard a lot about CPR. Maybe if you could explain when exactly I'm supposed to kick in with CPR, because we've heard a lot about it, and I think first instinct for me is someone who's collapsed. I want to try some form of CPR.
So it's the whole lymph mouth tube. Is that even?
Yes, it is. It is actually.
What am I supposed to do with CPR? When do I do CPR, and when should I not do CPR?
Okay, so if you're not trained, don't do CPR. Yes. Okay. So thank you, Tari. Cardiopulmonary resuscitation, that's CPR. So we normally use that technique when there is no pulse and there is no breathing, or both. So a patient can be unresponsive and they've got a pulse but they're breathing, or they're unresponsive and they're breathing but there's no pulse, or both can be there. So that's when you do CPR. But we don't advise just the general public to do CPR. Yes, because you just don't get on the patient and you start doing CPR. There are a lot of factors that you have to put into place. You first have to look at your environment as a safe. Let's say you've seen a patient or a person that's on the road and they're lying down and you want to go there and do CPR. What if something that has harmed them is in the environment? So there are a lot of things to consider. You just need to do a short course. There are courses that are offered by services, Mars and other places that offer these short courses for you to learn how to do CPR and what it encompasses. So yeah, we normally do it at the hospital.
So would you suggest like doing a normal first aid training here and there just to familiarize yourself with it? I mean, because it is important when you never know what could transpire when you're home, you know, and as a mom, I always think of my baby first. And still, like, I mean, like your family members, your helpers, you know, your partner. You never know what could transpire, and doing that could actually assist.
So you should really try to do short courses when you can. If it's the breathing, sometimes you can actually just help with breathing techniques. Those ones that we learn over the TV, where you breathe in through the nose. Let's do it together. You see, you feel better already. It does actually help. Sometimes it could just be anxiety, really. So, but don't try to do CPR if you are not trained for it.
chii chinokonzeresa kurasikirwa neupenyu panguva dzetsaona. Dzimwe dzenguva tinoona munhu anorarama, asi dzimwe dzenguva tinongoona munhu adonha atorasikirwa neupenyu. Chii chinokonzeresa zvinhu zvakadaro?
Okay, thank you, Tari. So, the situations are always different. This is a very broad topic. It depends with the intensity, it depends with the severity of whatever has happened. So, if it's bleeding, for example, kanamono aita a big cut, let's say achekwa panapa. It was a fight and achekwa where there is big vessels. They're most likely going to succumb to the consequences of that action than someone that's bleeding from a small vessel. So, it depends with really, but also things that we can control. For example, how urgent you call for help. Like we said, you always call for emergency services from ambulances who can take you to places like a corporate 24, where we've got doctors, nurses, and everyone on board 24 hours for emergency services. So it's about how urgent you call for help, how urgent you look for help, and also do not panic, because panicking again can just make everything go haywire in a situation. So try to be very composed, look for help, and ask for help as soon as you can. So that's the best that I can think of. It's mainly the time frame that people take to look for help. It's about the time frame.
So in a sum up, Doc, could you give us a briefing on do's and don'ts of an emergency?
Okay, so thank you. I think I've mentioned a few before.
Yeah.
Do's, well, let me start with don'ts. Don't panic. Do not panic. I know sometimes it can be very, very scary in a situation, especially you were saying you're a mom and you're seeing your child is not breathing well, you are bound to be very scared and to panic. So so that's why it's always good to call for help, because it can actually help you calm down a bit. But so do not panic during a situation like that. Another call for help. Do not panic, call for help. Be composed, make good decisions without panicking, but also at the same time be as very fast as efficient as you can.
Okay. That's amazing. So you've heard it, guys. This was all about emergencies. I hope we've touched on topics that are like really, really important. I think we've touched the basis with the help of Dr. Nyapokoto. I want to say a big thank you to our co-host Tarido, who's always on my side. But so that's about emergencies. We really hope you had something to take home today, and just stick with the do's and don'ts. You'll never go wrong.
Yeah,
true. Thank you guys for joining us again for Health Matters with Corporate 24. See you next time.
See you.